Hi, Destiny.
Hi, Miss Ivory.
I am so glad we get to have this conversation today. Thank you for being here. And thank you to Casey, co founder and president of Diversity and Diabetes, and the entire Diversity and Diabetes team. My name is Ivory Bennett. My pronouns are she, her, and hers. And I am a leader, an advocate, and someone who has lived with type 1 diabetes and who spent 17 years in the foster care system. Today, I'm honored to be in conversation with Destiny Jackson because together we're shining light on what it means to navigate two complex systems at once and why this intersection matters for the future of type 1 diabetes care and child welfare advocacy. Destiny, can you share a little bit about who you are and what brings you to this work?
Hello, everyone. My name is Destiny. I also go by DeeDee, and I have been diagnosed with type 1 diabetes at the age of 2 years old. So, for 20 years, I'm 22 years old, and I was raised in the foster care system. Today, I use my story to advocate for equity in healthcare and support for young people navigating diabetes.
So, really quickly, I was diagnosed at 16. So, my diabetes is a little bit younger than yours. It's only 18 years old. But it's legal and it can vote and it can buy cigarettes, honey. So, wait, do you have to be 21 now to buy cigarettes? I don't know.
No, I think it's 18. So, yes,
Okay.
it's legal enough.
I'm not doing that, by the way. I do not condone smoking. I'm just saying that. But I say all that to say is we've both lived with type 1 diabetes and we also spent time in foster care. So why do you think it's important to talk about the intersection of these two experiences? We're going to talk about that today. And I do want to note for the audience that we share more than two intersections. We are both cisgendered Black women who experience the child welfare system in Pennsylvania. Right. But for the purpose of today's conversation, we're going to focus on type 1 diabetes and foster care. So go ahead.
Yes, so I think it's very important to talk about the intersection of being type 1 diabetic, but also being in the foster care system because these are two major life impacting experiences in itself individually. So, being in the foster care system, very underserved communities, and like clearly, like there's lots of, I guess, people would say support when they're talking about systems, or governmental support. But honestly, when it comes to like personal care needed in regards of like, support and, everyday life experiences, like when you're thinking about the fact that you don't have two parents who are there to show up and support for you, or even just one parent who's counting your carbs, who's going with you to your doctor's appointments. These things become questions every single day and even sometimes multiple times throughout the day. So I think it's very important to talk about that. And sometimes there are different people involved. It's never really consistent support. And I would even say for myself, and I'm sure Ms. Avery, you can relate as well. For me, life was always something that always had to keep moving, but it was not always the same. So I think that is why it's very important to talk about these things. And oftentimes these experiences can also impact your blood sugars as well, which I would say, at least for me, like when we're talking about the impact of stress or life experiences and how those things impact your blood sugars, these things are real. You're on mute.
Oh no, thank you. And for the record, please call me Ivory, not Miss. I'm not that much older than you. Dang. And then DeeDee, right? You want me to call you
Yes.
DeeDee? Okay, cool. But there's so many things that impact type 1 diabetes that's just not discussed because of how whitewashed it is, unfortunately. And even the racial stresses that we experience as being Black people and Black women in particular, I think is not accounted for a lot. And we'll get into that a little bit more in our conversation, but I know for sure there's so many things that may seem insignificant or are not obvious to people who don't wear these identities and have to live the marginalizations of them, but are still relevant to the work that we are going to talk about today. So, I was diagnosed at 16. I just turned 35, and I was left in the hospital alone. And it was my first time ever being overnight in the hospital. It was so traumatizing and isolating. So it was the endocrinology ward and the oncology ward. And this young kid, he got upset and he was running down the hallway and he was ripping out his like IV treatment and there was like blood squirting everywhere. And it was bad. It was so bad.
Mhm.
And it was not a good experience. And I do think that part of that is because I was not in the home with my mother and my father. My mom would have been there. She would not have left my side. She would have made sure to check in with me mentally and emotionally. And my little sister, she was really great. She went home and called all my friends and said, Ivory's in the hospital. I know, like my foster aunt didn't even do that. So,
Wow.
there's that. But and they think I was probably sick for a few months before I was actually diagnosed. Less than a year for sure. But it was just a really difficult situation. And I will say this, shout out to Children's Hospital of Pittsburgh because I had really great nurses, really great endocrinologists, and I still have a great endocrinologist in the city of Pittsburgh. But Destiny, can you share a little bit about when you were diagnosed with type 1 diabetes, if you remember that because you were 2 years old, and what was it like for you, just some of your earliest memories?
So I don't remember exactly at what, like, I don't remember like the exact day that I got like diagnosed with diabetes and what it was like, but I can tell you that, like, kind of similar to you, before I even got diagnosed with diabetes, I was sick for a little bit, even leading up to the hospitalization that led to the diagnosis. At the time, like before I got diagnosed at 2 years old, but way before that, I was having like consistent seizures every night. Like my blood sugar, like they were saying that I had low blood sugar, and they had well, they weren't saying it was low blood sugar, but and not until after I had died until I got diagnosed with diabetes. But I kept having seizures every night, every night, every night. And they were saying, like, oh, she has like epilepsy. And so they were giving me seizure medicine. And I'm not sure if you're familiar like with any seizure medicine, but I was on like a liquid medication, so disgusting, called Trileptal.
Mm,
And I had to like take it every night. Oh my God. Trileptal was so disgusting, but Trileptal prevent was supposed to prevent me or make it easier, I'm sorry, make it easier with me going to sleep and like avoiding seizures, but I was still having seizures
mm,
every night. And so they were like, no, like she has epilepsy, but I don't know if she needs a stronger medication, blah, blah, blah. So I like, and every night, like I would have like these, like, I'm sorry, like seizures are like one of the most scariest things because I think sometimes people think that people just close their eyes and like just, like they just go unresponsive. But like there's a state your mind and your body enters when you're having seizures. So for me, like I would scream in my seizures. Like I felt like the world was falling apart. But like I would just scream and like for help and like but I couldn't really help myself. And even after I got diagnosed with diabetes, I still had a few years where I was going on with seizures, but it wasn't just the seizures, it was diabetes as well. And so when at one point I know that they were stating that like I kept like urinating. My family mentioned that I kept urinating and like there would be times that I wouldn't eat my food and like I was gaining weight but then losing weight and I just kept urinating all the time and I was just always thirsty a lot. And
right, right.
so it led to me being in the hospital. And I remember like there was like one time when I was younger and I was in the hospital for like almost 2 months. Two
Wow.
months because they were trying to figure out and they were just running tests, running tests, running tests, and they were trying to figure out like, what's going on. And then I had got diagnosed with diabetes. I do remember when I did my first blood sugar check, I like lost my mind. I lost my mind. The needles, because at the time I wasn't on like a CGM, and I don't even know if CGMs in 2005 was CGMs like a big thing because I didn't get a CGM until I got to like middle school, until around like 2010.
Yeah.
But yeah, 2010, I think that was.
I think they would have been newer. I don't think they would have been as widely available and as accessible around that
Uh,
time. I think
okay.
they
So
existed
yes,
now.
around that time,
Yeah.
I finger sticks were still a thing. And oh Lord, I lost my mind. Like I could feel, I remember I had like marks all over my fingers. Those were so horrible. I was like freaking scared for my life. Like I would literally run under the bed. Like I didn't care much about taking the insulin shot. It was the finger sticks itself. And I'm not sure if the level needed to be adjusted at the time. And of course,
Probably.
I don't
Yeah.
even know if I knew like if I was like that into it to even know, but I was so scared. So that is what I remember for my diagnosis. And then over time, and I think it didn't take that long for me to, finally get used to it. Because by the time that I was like 6, 7, I was checking my own blood sugars, counting my own carbs, and taking my own insulin. So I caught on to it real quick. And I was like, and then I got to a certain point where I was like, I don't like people giving me my needles. I do my own. And I think that probably was a part of the reason why I used to run and stuff because people were not very careful with how they pricked me or pressing the
Yeah.
needle all the way in my finger. But I
Oh,
knew how to do it to a way that made me comfortable. But my diabetes diagnosis experience was like very frightening for me in the beginning until I learned how to, make myself feel comfortable.
oh. Poor baby. I'm giving you a virtual hug. I'm like, because I have my 2-year-old, as I've talked to you about before offline, and I just cannot imagine how that would feel. I do have a story about the fingers. Fingers are a big thing for type 1 diabetics, and I remember, and I use a lot of oils and lotions, so my skin's soft, my hands are. And I remember sitting in the hospital on the bed because you don't, y'all, when you get diagnosed with type 1 diabetes, you don't have to do everything yourself at first. The nurses will check your blood sugar, they'll give you your
Yeah.
all those different things. And so she was feeling my hands and she's like, "Oh, your hands are so soft. That'll change." I was like, "Oh my
Yeah.
change." And then I remember a few months later, you can look on your fingertips and you just see all these little tiny holes because of
Yes.
all the blood sugar pricks that you have to do over
Yes.
time. And you have fingers that you favor more than others, but even still, when you like spread it out and diversify your locations, you still get those little holes in your fingertips. Not so much now because I have a CGM, so I don't really have to do it. But it was bad when I wasn't. I didn't get my pump and my CGM until I was like in college.
Oh wow. I don't know what I would have done if I would have had to wait until college. I got mines when I was in like elementary, like I would say like fourth or fifth grade, and Lord, it was like literally a life changer.
Good for
But
you.
like
I was
that, yeah, I'm sorry.
No, 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 you're good. So, but I'm a little bit older than you too, though. So that would have been around.
Oh yeah, probably around the same time, but you
It
were
might
just
have been, yeah.
yeah.
Mine would have been 2010-ish. When did you get your?
Oh yeah, I was around 2010. Yeah.
That's insane. Like
Because
2010-ish is when I got my first pump, and like it was a big deal. It was hard though. It was my last year being in child welfare before they aged me out too.
yes.
So I had to like figure out how to use it, and then I lost my insurance coverage like a few months later. It was.
Oh my gosh.
I know, girl, but what I was
I
gonna
know that
say is.
I've been there.
It was we'll get to there too.
Yes.
But with the diabetes stuff, oh, it's just so complex and so difficult. And I'm grateful for the advancements of technology. That's what
Yes.
I say. And I don't know about you, and you might not remember this because of how young you were, but I got to be in my honeymoon phase for at least like a year, year and a half. And so the first year, year and a half was not that bad because the honeymoon was heavy, honey. It was like my blood sugars were, my A1C was around fives, maybe sixes towards the end of the honeymoon, but it was a really long, gentle honeymoon period. And then it started smacking me around. But
So when you say honeymoon, do you mean like that was like a sweet time, like after you got diagnosed with diabetes, like it
it
was
was
cool for you?
like it wasn't full blown type 1 diabetes yet. So my pancreas was still seeming to produce insulin
Oh.
and or my metabolism was still really high because I was incredibly athletic at the time.
Oh,
Yeah,
okay.
I think just because of how new my diabetes was in general, like my system wasn't completely worn and depleted yet. Like,
Yeah.
it still had the remnants of having a working pancreas going on. And I feel like there's something to that. So, and the doctors were calling it the honeymoon phase. So oftentimes what happens when you're older and you're diagnosed with type 1 diabetes is that you don't immediately go from like 100% pancreas working and fully functioning to 0% fully functioning. It
Yeah.
actually like slides down gradually. And so that's how I got to experience it. But did you not? Did or
No.
no,
Nothing like that. I was definitely gonna say can't relate.
you were so young. Like do you
Yeah.
think you could have been born with it and they just
Yeah.
no?
They think I was born with it. Yeah.
Okay,
Even
yeah.
though my diagnosis came at like 2 years old, like I was basically presenting all the symptoms basically since birth, but they were misdiagnosing me. So yeah.
That's so unfortunate. And like hopefully they have different protocol now that they're checking blood sugars and
Yes.
especially when there's like seizures involved. That is so scary.
Yes.
Okay, let me get us back on task. I knew this would happen with you. But anyways, so
No, forgive me.
let's take it back. Let's look at the intersectionality of things. How did being in foster care impact your ability to manage your diabetes? I know we talked about this briefly on my podcast interviews, but can you elaborate for today's audience?
Yes. Wow. Being in foster care impacted my ability to manage my diabetes in so many different ways. I would say, even at one point while I was in foster care, I came in foster care when I was about 7 years old, and I basically aged out until I went to college. And so that was like all basically all throughout middle school and high school. At a certain point, all in high school, I was homeless, so I lived in a youth shelter. So I think that was a point where it was like, okay, at one point, I was couch hopping before they found me like a foster home. I was just, staying at friends' house, one friend this day, another friend that day, blah, blah, blah. And so, different people have different like rules with their housing and stuff. I would definitely say there were points where like there were nights that I did not eat. So like I would go to school. I was always a school kid. Like you couldn't. I don't care what happened. I'm telling you, I could have been couch sleeping on someone's house all the way in Jersey or Delaware, and I'm telling you, I would have made it to school on time by 8 o'clock.
You and
I
me
would have been
both.
there.
You and me both.
Yes, I was very dedicated. So for me, I made sure that I always got to school, especially that was like a very important time for me to get up for school on time, make sure I made it to breakfast, lunch, and also I would definitely say my school was very supportive. And because they knew of the situation that was going on, with me experiencing abuse from my biological mother, that they knew that like, okay, like Destiny has a lot going on, so like we make sure like she eats, blah blah blah. And then sometimes I also went to after school program at my school, so like they had like snacks and stuff. So I would just take it home. I would keep it in my backpack to last me over throughout the night, because 9 times out of 10, like they weren't like the houses. Even though like I was cool with people, I think there were times where I hadn't felt comfortable yet asking for food. Like I just always thought that like if you lit or if you were residing in someone's house, that it would be normal thing to just say, hey, it's dinner time. Do you want to eat? Are you hungry? But everyone's house operates differently, and also some people might have been in financial situations where they probably were barely making it for their family. So I never wanted to be that person counting in, and I was just grateful for them even allowing me to like sleep in their house. So I just never wanted to like overdo my stay. So I was like, okay, let me just expand to other resources. Even when I was in school, I've always been the person very involved in extracurricular activities. I always did community service, and sometimes there would be people that would like say, oh, we're gonna if you attend the event or you come to after school, we're getting pizza. Okay, cool, I'm getting my pizza, I'm gonna wrap my pizza up and I'm taking it home. So at least when it comes to dinner time, okay, I feel better than knowing that I need to eat. That wasn't an everyday situation, so there definitely were some nights where I didn't eat and I maybe probably only had 50 cents or a dollar to my name. So I'm going to the store and I'm buying a bag of chips and some water, and I'll last until the next day. um so that was definitely that with my couch hopping experience, until there was stability found when I did go into a foster home. When I was in a foster home, the ability to experience or manage my diabetes, I think it was very good on my end, and I did everything that I could. But it was really hard when there were people that just didn't understand like diabetes as well. And there's always a different perspective between people who actually have diabetes versus people who learn about diabetes, and they think that like diabetes just is just a quick A B = C, and I'm like, oh my god, like no, like the body is a very weird place. Like, and
Mhm.
even if science says this, your body may not do that.
Yes.
And
Yes.
so there were often times where yes, I might have ate a meal and I took my insulin and my blood sugar's high, and people were like, you didn't take all your medicine. Like, did you count your carbs right? And I'm like, whoa, I did exactly what I was supposed to do. I don't know why my body is doing this. I can take more insulin. But then it would just always become, I often got labeled as that person who doesn't care about their health, or, not doing what they're supposed to do, or not taking care of themselves. It was just like something that was like very like, so then honestly, like I definitely recognized it, and it took me a little while to actually understand that after that I started to become very private with my diabetes, because now I'm no longer telling you my blood sugars. I'm not sharing you on my CGM, because all you're going to do is look at a number and you're going to label me. Very similar to the school system. They're going to look at a grade and they're going to assume that you're a bad student versus good student. And honestly, you can't do that when it comes to my health, because I'm honestly, do you like, are you stating that I am like, I don't know, like suicidal or something? Like I would put myself in a situation that I wouldn't do something, like not saying that these situations aren't real, but it just became very like offensive to me when people would make those comments. So I became very like to myself about like my diabetes, which is where I stepped in more, and especially when it came to like social workers and like other people being involved, like with my in regards to my case and me constantly moving foster homes, because people assume that, oh, like they'll be like, oh, your blood sugar's high, you're not taking care of yourself. Then boom, I don't know if my body like just was insulin resistant. Then boom, all of a sudden all my insulin would kick in from the insulin that I took, but people said that I wasn't taking care of myself. Then my blood sugar would drop super low at night, and then guess what? I have a seizure. Now people are like, oh my God, now I'm in the hospital. Now they're like, oh, I don't want to be responsible for her because what if she dies? And I'm like, okay, so it's no shade, like, damned if I do, damned if I don't, you know? Because like it's like whether it's up or down, you're still going to be scared, which I think that no longer becomes a me issue. It's very much a you issue. Whereas though you it's something that you're just not comfortable with, you know?
Yeah.
So I definitely had a lot of those experiences being in the foster care system. And then even when I was homeless, um, literally I was just explaining this to someone the other day, and I was telling them like when I was like my hardest time that I believe was when I was homeless, when I was living in a shelter, and there was literally like not like that many like accommodations like for foods and stuff like that, you know. My medicine was always locked up, of course, because you can't like just walk around the shelter with needles and things like that out. I had to ask for my insulin, but then like I would have to wait for someone who's certified or medically certified to get on the phone
I
for me
know.
to take my insulin and stuff like that, which is why I'm so happy like that at a certain point, because when I first went into the shelter, they were saying that I couldn't be on my insulin pump because I needed to be supervised when giving medication. But because my insulin pump was on me at all times, they couldn't guarantee that I was going to do it under like I would tell someone when I'm bolusing myself, which I feel like, come on, are you kidding me?
Did you ever get turned down from a shelter because of that?
Yeah, I've got turned down from shelters just because of having diabetes.
Oh
Yes,
goodness, that is something
yes.
that this is the first time I've heard that.
And the shelter that I actually did get accepted into, I mean, God forbid now, like, but they really took a chance on me. Like, they took a chance. Like, they weren't even supposed to accept me, even just through like regulations, because like, when you're in foster care and having diabetes, you can't just go to any foster home or go to any shelter. You have to go to medically certified ones. But the shelter that I was at wasn't even a medically certified one. But the reason they accepted me was because they saw that I didn't have any other issues, and in my referral notes, it stated that I was very responsible with my diabetes. And so they took a chance, but they were like, this is not even a space you're supposed to be in because we're not even equipped to have you here.
That is, my mind is just going now. And we're going to have to talk offline about
Yes.
this. We do not have enough time today to talk about all of that. But wow, my goodness, because it's like also we do this kind of stuff all the time. We talk about advocacy, we talk about type 1 diabetes, we talk about child welfare all the time, right? But like that is literally something new that I learned today. And that is just so incredibly unfortunate. And for those of you who don't have child welfare experiences, Destiny is basically talking about several things. And one thing I want to highlight for the audience is the adultification of it all, right? Neither one of us just got to be children or babies or just have fun in that regard. We had to think about blood sugars. We had to check our own blood sugars. We had to give ourselves shots. We had to think about how many carbohydrates am I taking? Do I have gym today? Do I have volleyball practice after school? Do I have dance?
And even to add on to that, like when I got to high school, my doc like the support became so inconsistent or just unreliable that when I got to high school, my doctor, I went to Children's Hospital of Philadelphia for all of my medical stuff until I aged out. But literally like the support became so unreliable to the point where I was missing endocrinology appointments and things to be up to date because of the fact that social workers weren't always available, or people were not saying that they were going to pick me up and take me to an appointment, but then they would never come or never show up, or they would get me there super late, and then at that point I missed my grace period. My doctor literally had to put in like a thing to security, because when you go into the doctor's office, they want to see your ID, they give you a pass and all of that stuff. My doctor sent over like a very urgent like I'm sorry, message to security, to the security system, and had to get it approved, and went through all these loops for it to say like, oh, starting in Destiny is please approve Destiny to come to her appointments by herself,
Mm.
because people were not showing up. So when I got to high school and when I was in that shelter, majority of the time I was going to my own doctor's appointments.
Jeez Louise.
Yes,
Okay.
like I was going to my own physical, my own endocrinology, and I stayed up on it. And like that was a point where I really had to learn, but I was going by myself. And like my doctors were like, wow, like this is very unordinary and like very unfortunate, but like we're glad that you're on top of it, because imagine how many doctor's appointments I would have missed, or what my A1C possibly could have been, or how much I would have learned about my body, but it would have been through hospitalizations and not those consistent doctor's visits. Yeah.
And how much worse off you would have been for aging out. That's
Yes,
another part of this component, right?
very,
You're not
very
starting
bad.
strong in terms of aging out, being completely independent. For those of you who don't have child welfare experience, aging out is basically when you lose your systemic and institutional supports from having been in child welfare. And so a lot of times, and in Pennsylvania in particular, around my time, at least when I aged out, you didn't get to keep your insurance past 21. So
Yeah.
I was still in college. You didn't get to keep yours either?
No.
Wonderful. Let me get us back on task. But it's really difficult, and you want to start out as strong as you can once you lose those benefits so that you can have a strong footing on which to stand. And oftentimes that's not the case. But let's rewind. So, because of my age and the agency that had already taken over my health, I was really self-sufficient with type 1 diabetes. I'm really grateful for that. I didn't really technically need any supports from the adults around me. I think I needed way more emotional and mental support for sure. And I wish there would have been more initiative to understand the basics of type 1 diabetes. Like, what do you do when a blood sugar's low? You don't give insulin, you give sugar. You know, basic things like that. People around me just still don't even know until this day, and it's been almost 20 years. But that's neither here nor there, right? So, what kind of challenges did you face with caregivers, doctors, and systems? And you kind of already kind of touched on that and talked to it, but can you reiterate for the audience just so they can understand the perspective of having been not only a type 1 diabetic, but a foster kid too?
Yes, girl, what did I not experience? Yes.
The tea.
So, with caregivers specifically, and I would even say caregivers and social workers, like people, it was always like an inconsistent like support throughout my journey with them being in the foster care system. So I felt like there were either people that came in down the journey either like late when there was already a bunch of stuff happening, or they were there in the beginning and then they either had a gap where they weren't there and then they came back. So there was always like this inconsistency of not being up to date. So when things were happening, whether again like I stated my blood sugar was high or it was low, or if I was in the hospital, or if like anything happened to me, it was always, you're not taking care of yourself, you're not doing what you're supposed to do. But then I would also say a challenge that I had was that I, again, yes, there is diabetes education and you can go and get diabetes education, but that does not make you a pro on diabetes. And so for me, like one of my biggest challenges again was that people just thought that you eat, you take insulin, your sugar should be great. And yes, that is supposed to be the case, but that would not always be the 100%. You know, there may be a time where you are going to do exactly that and your sugar might be like 280. And you're like, I did my math down to a T. Like, what is happening? And it's like these things happen. But a challenge that I had was people saying, like, you're not taking care of yourself. Oh, like now it's going to be challenging for if you're trying to do X, Y, and Z, or now it's going to be challenging in order to like to for your foster parent to keep you because your blood sugars keep going up. And I'm it's not my fault. Like it's kind of like I definitely was challenged with being punished for my blood sugar levels. Which after a certain point, I just got to a point where I was just like, I don't care. It is what it is. If I get punished for my blood sugar being high, I don't care. If I get punished for my blood sugar being low, I don't care because I didn't ask for this. You did what I'm saying? So like you getting mad at me for something when I've done everything that I can, like it was just ridiculous. Another challenge again, another challenge that I faced as well was just with the doctor specifically was just you know me not being able to attend my doctor's appointments because of me not having the support. So with that being said, again, my doctor had to send over a note to the security team over and like head leadership people who oversaw like the hospital and like outpatient services for me to be able to attend my doctor's appointments all alone without a parent or guardian due to the circumstances. I would definitely say those were some of the challenges when it came to getting the care that I needed. But yeah, that was a lot. Those it might not sound like a lot, but it was definitely
It
bigger.
sounds like a
Yeah.
lot. It
Yeah.
sounds like a lot to me, and I think that there's so much more that we could discuss. We're just touching on like the big pieces that we
Yeah.
remember, but the thing about type 1 diabetes is there's so many little pieces that make it up and the intricacies of it all. And the thing about diabetes training, whether it's child welfare specific or not, is that very few people talk about the impact of hormones and the developmental stage that the body might be in during these times. And so when we think think about being a transition aged youth or a teenager or even a young adult. And I only know this because my current endocrinologist, who is an adult endocrinologist, told me about it and walked me through it because at the time I was at the end of my 20s before I moved out of Pennsylvania for a few years. And he was telling me that at the end of your 20s, it's kind of like the last major arc of this like hormonal shift and spike that you
Yeah.
experience in the growth and development of your body. And he showed me the chart and it looked like a freaking roller coaster from like 9 to like 30. And I
Yeah.
was like, why did no one ever share this for me? Because like you said, you could be doing everything right. You could be counting your carbs. You can be fully hydrated. You can be giving yourself your insulin and your insulin is 100% in working order and condition. Everything can be functioning properly, but your body is changing and
Yes.
it's not accounted for. And that happened overnight. And you had a spike in whatever hormone, and that's
Yes.
why your blood sugar is super high or super low.
Girl,
And so,
literally, like one of my like first times like going into DKA was literally because they had found that, well, at the time they didn't know, but that was when I first started showing signs of like my PCOS.
mm,
And like after like my third or fourth DKA, they was like, you have PCOS. And it was like a thing where we had to keep like waiting. Like I wasn't getting a cycle, but then I would get a cycle, but then I wouldn't, then I would. But then I would be experiencing cramping sometimes. But then every time I would experience cramping or nausea or something, like my blood sugars would go through the roof. And I would take insulin, my blood sugar would never go down. And so it
the
was like,
inflammation.
okay. And then I'm like, is there something else going on in my body? Or like what's happening? Because I'm not bleeding, but I'm getting cramps, but then my blood sugar is going through the roof. But then they noticed that every time my cycle came one of that time of the, or Mother Nature came to visit me, that my body would become insulin resistant. But then people would be like, oh, you're not taking your insulin. Why is your blood sugar high? But me not even knowing, it's like, how can I tell you? But I'm doing everything I'm supposed to do.
And
I
this is
got
where
diagnosed with
gender,
PCOS when I was in the shelter.
this is where gender enters the chat.
Yes.
Let's talk
Yes.
about that
It's
intersectionality.
the intersection, not literally, okay?
Like, gender, type 1 diabetes, from the perspective of being born with a uterus, is way different than not being born with a uterus.
Yes.
And we acknowledge all genders and identities here. We are LGBTQIA2S plus friendly. Love y'all.
Okay.
I.
Love y'all too.
But when we talk about the science of it all, there's not enough differentiation between the two assigned sexual genders at birth. The way we experience hormonal shifts and fluctuations absolutely affect, and I think there's been conversation around creating algorithms specifically for pumps that acknowledge at least the 28-day cycle, which we know would not be applicable to people who have PCOS or other issues that affect it or that are not a typical cycle structure. But again, we could talk for hours about this. Let me get us back on track, Destiny. Okay, so just to reiterate for the audience too, though, for me, my diagnosis was another form of adultification. And having spent almost 20 years in foster care, there's so many examples of adultification and parentification that I'm sure both of you, me and you have experienced. And managing diabetes while in care only contributes to that and those feelings of isolation and burden and responsibility. I remember specifically, and I mentioned this before, about transitioning to my pump when I was in underground around 2010, which was actually the last year I was in child welfare. I was getting aged out. My mom decided to die. My brother's mom passed away.
Decided.
We had a suicide in my building. I was an RA at the time, so that's why it matters. I was working like two, three jobs, right?
Oh my
It
God.
was, and I was at the University of Pittsburgh, which it's a massive school. I think there were 10,000 people in my class alone and
Oh
about
my God.
40,000 undergrad students. So it was really easy to get lost in
Huge.
the sauce. I only say that to add context. And my little sister kept running away from care too. She was in care. And so our foster worker, care workers would call me and say, hey, or send me like Facebook messages like, can you go find your little sister for us? Sure, why not? It's like that meme where the dog's sitting at the table and the fire's burning all around him. Like, I know. I can do that. I can make that happen for you. And so
Oh,
that was the environment in which I was starting a new pump therapy, and pumps can be really intimidating. And then to only lose my insurance a few months later was just the icing on the cake. So did you ever experience any of those kinds of elements when you were aging out or having lost your insurance or having a lapse in your insurance? Like, did you have something similar?
yes, so not when I was aging out, but I would definitely say actually very recently. I want to say this was around like May or June of this year. I had lost my insurance. And you know, I just turned 22, so literally like it was not that long ago. And they were like, "Oh, like you need insurance." And like I like it was my first time ever me like having to find insurance. Like I knew nothing about insurance because of course I had practically spent my life in the foster care system the whole time. So when you're in the foster care system, it's given like insurance and everything. And so I just thought that like I had insurance because I was diabetic. So I was like, you wouldn't like take away like my medical, right? Like the things I need to survive.
Oh,
Oh girl, they did. They took it away. And I was without insurance for like almost 2 months. Good thing I had like a bunch of supply to like last me. And thank God to like the diabetes communities and stuff that anything
yes,
that I
yes.
lacked on, that I was like, hey, do you have any more needles? Because I got insulin, but no needles. I got peanut butter, but no jelly.
It is so real. But also shout out to Chronically Will and the groups that we're involved in with him because we have some tight T1D communities and
Yes,
there's nuance in it too. I mean, us in general, I think we're like in a people of color group and we are in
yes,
a women people of color group. And
yes,
it has just been a really beautiful space. And not only that is the community there, but like you said, the shared resources are there.
yes,
And even if we can't give each other stuff, we give each other tips and like
yes.
experiences like, hey, maybe you should get tested for this because I didn't know this was going on with my body and that's really what happened. And so it has been a really big help to me. And I hope that you
Me
even
as well.
continue to see it as a resource and a source of hope and sisterhood and brotherhood and community for you.
Yes,
So shout out to
yes.
Chronically Will. We appreciate you.
Shout out. Because honestly, that is how I got insurance back. So when that happened, it was like, okay, of course, like I am not in care, so there's no one like providing me housing. So I have an apartment, bills got to get paid. I'm working, I'm in school. I'm like, I need money. They were like, you make too much money for Medicaid. And I was like, what? I'm like, what do you mean? Like, I'm like, I have to work. Like, what do you mean? Like, I literally, like, I pay bills, I have to work. And so they were like, yeah, in 30 days, your insurance is going to be cut off. And I was like, so I started looking for other insurances and like literally like there's this thing like because technically I'm still considered like a Pennsylvania resident even
Uh,
though like I go to school in Georgia. So they were like, you can use this thing called Penny. And so I'm like, okay. I started looking at Penny. It's like, oh, I'm like, you gotta pay like $100, and then you got like this $20,000 deductible that you gotta pay out your own
Girl.
medicine before they step in. What am I paying you for? I'm like, I'm gonna like, no shit. I'm like, you want me to like that's what you want me to like, what is the point? So I was like, it wasn't helping in any type of way. And then it was like, oh, in order to go see your doctor, you got to pay a $50 copay. And I'm like, do you know how often I see doctors? And I'm like, not just endocrinology, you have to, as a being a diabetic, you have to see other doctors more frequently as well, just because diabetes can target other parts of your body. So I'm like, I have to see an eye doctor a little bit more often than a normal person. Like, and you know, my dentist, all that, all those types of things. So I'm like, dude, you want me to just run money and me paying you for what? Just to say I have insurance? No. So they share with me MAUD from the Chronically Will community, and they were telling me MAUD is like medical assistance for workers with disabilities, and it's basically Medicaid, but instead of you getting it for free, like you pay like a upfront like monthly like payment, kind of like if you were paying for insurance every month and you had a cost, but it would cover everything. So I
Mm.
was like, I need that. Okay. Like I need that. So that was like the most scariest time of my life. And like there was time like during that time, I had probably missed about like 4 or 5 appointments within that 2 month period. I had missed my endocrinology appointment. I had missed my my gastroenterology appointment, which I think at the time they were saying that I was possibly experiencing some what is it? Insulin resistance due to having gastroparesis, but I
Oh,
couldn't even get the proper testing because I
right.
didn't have my insurance at the time of my appointment, which it was so hard for me to even get an appointment. So I was hot. I was so pissed.
I'm sure you
Um,
were. Oh my
yes, I was because
goodness.
it's hard being an adult. Like,
I know. It is, listen, it is the worst hood. Adulthood is the worst hood I've ever lived in. And
yes,
I've lived in some places, y'all. So, so
you, me, us both, literally.
it is not, we could talk all day, but listen, I need to move us forward. But it sounds like one thing that could have made a difference for the both of us is that continuity of care and access to our health insurance.
Yes.
And that's one of the things that I like to talk about and champion for change is that if you have child welfare experience and especially the intersectionality of any kind of chronic illness or situation, you need lifetime access to Medicaid. It shouldn't cut off because you turn a certain age or you leave a system. You should be able to access. And you know what? Healthcare for everyone, honestly. Like, why is that even a negotiation? But I digress. Let us get back on track.
Yes.
Let's get back on track. So, Destiny, is there something that you would like to ask me?
Yes. So something that I hear in your story is how hard it was to keep continuity of care, and just all the different situations happening, loss of insurance, being diagnosed, getting like it was just so like it was really a lot, which I'm sure very much impacted your life and probably even who you are today. Moving one place from one placement to another, and like that just really makes it impossible to stay consistent. That was my experience too. So I wanted to know a little bit more of what that was like for you.
I mean, I'm really grateful that I was as old as I was because I didn't have to go through the amount of placements that I went through as a child, as a diagnosed teenager. But it definitely touched on like it making me who I am today. And I think that, and we talked about this in the podcast, even though I've experienced a lot of things in life, this is the worst. This is the worst because of the lack of agency and advocacy I feel over my body. Like when your blood sugar is extremely low, it is so scary. Like there's no sense of control with that. And like you said, it doesn't even always make sense. Like sometimes you've done everything right and it's still not good enough, for lack
Yeah.
of better words. And so that's the incredibly like marginalizing and frustrating part about it for me. But in terms of how that's shown up in my life, I feel like I have to cater to this disease.
Yeah.
It's one of the reasons why I work a lot because, like, I don't make enough money to be able to just pay for everything out of pocket, firstly.
Yeah.
I make too much money to get government assistance, right? But I also don't make enough money to be able to afford everything on just
Yeah.
one job and one
Right.
salary. So it's like I have to, and I'm saying this as someone who has a master's, someone who's highly qualified in multiple
Yeah.
fields and industries. I have to work two and three jobs just so that I can afford to take care of myself in the way that I know I need to take care of myself. And another thing is like when it comes to type 1 diabetes, medicine and medical supplies are not the only parts of it. For us, food is medicine. For
Yeah.
us, supplements and vitamins and minerals are medicine. And God forbid you have any comorbidities like any other condition that also requires medical treatment, medical supplies. I'm really grateful to be healthy and I don't really have to worry about that intensely. But I do spend hundreds and hundreds of dollars on stuff each month for my type 1 diabetes. I just got a call today from the pharmacy, and the pharmacist was like, "Hi, Ivory. I just want to check and make sure that you want this prescription. It's the Dexcom transmitter sensor, and it cost, I think it was like $243. It cost $243. Are you sure you want us to fill that?" Yes, girl, I'm sure.
Oh my God.
Do I want to drop $300 on?
Right, exactly.
No.
But oh my God, that
But
is
I need it.
expensive.
I need
Yes.
that's with insurance,
Yes.
Destiny.
Oh my God.
Like, that is with
For
insurance.
God's sake. That is very
Like,
expensive.
yes. And so when people are like, "Why do you work so much?" I'm like,
I have to. I gotta survive.
I have to survive. Like that's just
Yes.
one thing out of several things that I need every single month, every
Yes.
single day. And so it does definitely has like taken over in a lot of ways. But I'm hoping that through more advocacy work around T1D and also the intersectionality of T1D and other parts of my identity that I start to feel a little bit more empowered because it's not all gloom and doom. I've been able to meet people like you and develop community with other people who have type 1 diabetes and who are killing it and who have also been able to normalize the experience of living with it. So in that regard, um, it's been fruitful in that regard. But also, if I could give anything to not have it because I got to experience my body for 16 years without it. And so I know what it feels like to be able to have that freedom. I miss it. And it felt way different. I didn't feel as tired, Destiny. I had more energy. I could work out real hard. I didn't have all these scars all over the place. So yeah, it's definitely impacted me in those regards. But we both also mentioned how stress and trauma have made our blood sugar management harder. And it's not always acknowledged medically. Sometimes doctors don't think about those factors when they're talking to you about your blood sugars and your A1C and your condition and thing. So, can you talk about how mental health and T1D have collided in your own life?
Oof. Oh my gosh. I swear I get trauma every time someone asks me this question. It has impacted me in a way that like not in a million years I could ever think would even that it would impact me. So, for me, like I stress looks different for everyone, And like I never thought that like, yes, you hear like stress impacts your body. Yes, stress does this, it does that. But like literally it was again last semester of school, well, last fall of what is this is 25, so fall of 24. I was going into my senior year of college. Spelman College, by the way.
By the
Yeah.
way, clap, clap, clap.
Yes, Spelman College. And literally, after homecoming, I had just moved into my new apartment for my senior year, working two jobs. I was in school trying to finish out, go strong. Y'all, I went into DKA after homecoming. My body was fighting off a cold, and I literally was like, I don't know. I mind you, like I've only ever had a cold ever. That was my only like twice ever in life that I've ever had a cold. And like I would say my immune system is very strong, And I'm not the one to put anything past, like to just go out there and be like, oh yeah, my body will fight it off. But like I would definitely say like it's very rare that I get sick or anything like that, other than like diabetes, like high blood sugar, like low blood sugar symptoms. Girl, I went to sleep one day, and just went to sleep, early one day on a Sunday night, and my body's just fighting off a cold, and I just had a really, really major headache. But my blood sugars were fine. Woke up the next day, guys. I had sleep paralysis. Couldn't even get out of my bed. I was stuck. My all I felt was my heart racing, and I was stuck. I couldn't even move. Like I was laid in my bed. Mind you, on top of that, sometimes I'm embarrassed to say this, but I will definitely share this. I had urinated my bed.
Oh my
That
God.
was not like normal for me.
And your blood sugars or
I'm a very like I drink a lot of water, but I don't urinate the bed. So I
mm,
was like, okay, what is happening? I couldn't move. Like my heart was racing, racing, racing. Like I felt like I was like slowly like in my sleep. Like I'm sorry, in my bed. I couldn't even move. It took, let me flip my phone over. It took for me to say, hey Siri, because I couldn't even get up or anything, grab my phone, check to even see what my blood sugar was or anything like that. Guys, I said, hey Siri, and called my foster mom in Philadelphia, and her Dexcom was going off, and she was like, you need to get up, and I was like, I can't get up, I'm stuck. Like I was like, I need help. She called 911. They had to like break down my door in my apartment in Atlanta to get to me. They got to me. My blood sugar was so high with the EMT. The blood sugar meter that they had couldn't even read my blood sugar. It was so
mm.
high. The EMT had to lift me up. They had to change my clothes for me. And as they were changing my clothes and putting me into the stretcher bed, like literally, like they said my heart rate was 187. 187. I hadn't even moved. I had missed class that day, everything. I
Right.
didn't know what was happening because I was completely great the night before. My blood sugar is so high now and everything was just going crazy. They said it was because of stress. Apparently stress releases a chemical in your body. Can't remember the name of the chemical that the stress.
Cortisol?
Cortisone, yes. Stress releases
Mhm.
cortisone in the body, and cortisone can make your body insulin resistant. They
Yep.
said I was stressing so much from school, me working on my jobs, and just doing so much and ripping and running that it made me so stressed, and that it put me into it took me into a diabetic coma. I had to leave school.
I'm glad you're here. I'm glad you
I,
made it. That is like so scary. And there's a supplement I'm gonna send you. I actually take it right now, especially because of the last year of my life has been crazy. We talked about too, and I know my stress chemicals were spiking. And
yeah,
so I take a supplement that helps target cortisol, high cortisol. And I feel like for Black women in particular, we just have so many stressors, micro and macro, every
yeah,
single day that if you don't have the soft life or people who are
yeah,
actively helping you facilitate a soft life,
yeah,
it's really easy to be stressed out. And
yeah.
unfortunately, for people like us with type 1 diabetes, we see and feel that immediately, whereas other people get away with it. And it's not that they're not impacted by it, but they can skate along with it further and longer than we can usually do. And so, in that regards, having type 1 diabetes forces you to be a little bit more proactive and immediate with your health and your well being, right? But dang, it's still hard. Okay, we only have a few more minutes left with these good people, Gordon, Destiny, and like, we're talking about cortisol and stress relief. But okay, I'm gonna try to get us through the rest of these
Okay.
questions. So thank you so much again for your willingness to just be here and have another conversation with me. And I
Oh,
hope that someone somewhere can be bettered by listening to us share our stories. But why do you think these issues matter for the broader type 1 diabetes community? Why does it even matter?
I think that these issues matter for the broader type 1 community because one, it's an experience that goes unseen that I think that not many people really talk about, but it's something that impacts people's lives every single day. And just like for us, like people don't really possibly talk about Medicaid or Medicare every day in this current political climate,
Mhm.
but there are issues that impact people who have intersectionality between foster care and diabetes that probably it impacts even 10 times more. So I think that these are things that are not usually brought to light. And it deserves to be seen and possibly supported by other type 1 diabetics to bring light to.
Yeah, I agree with you too. And from little things like being in a foster home where they lock the refrigerator at nighttime or not being allowed to have food or
Yeah.
juice upstairs in your bedroom or wherever it
Yeah.
is that you're sleeping, there's so many things that, like, if you are a child welfare person who's experienced that and a type 1 diabetic or any other kind of chronic condition, for goodness sakes, like, it is just not easy to get what you need and to have done what you need to have done. If
Yeah.
you could tell doctors, policymakers, or advocates one thing about foster youth with T1D, what would it be?
Make a difference.
Mm,
I would say make a difference. If you are in the spaces and you have the ability to impact someone, even if it's one life or one situation or one occasion, make a difference. I would say it was because of different people supporting me in different spaces, even if it wasn't always consistent. It got me to where I am today, and I just know the power of being able of advocacy and standing up and making a difference and just being there. Be
mm,
there and make a difference.
mm. I think I'd say to facilitate joy and to be curious rather than accusatory, right? So, how can you help people experiencing type 1 diabetes and child welfare have fun and play and reclaim as much of their youthfulness and their childhoods as possible? But also, how can you not judge and lean into curiosity when helping and trying to support them with their type 1 diabetes or any other diagnosis that they might have? So, thank you for sharing. What do you wish people understood about living at the intersectionality of these two identities?
I wish that people understood the impact of mental health and how experiences could impact your diabetes. Um, Changing or moving a foster home impacts your diabetes. The change in a meal or, missing one meal could impact a life. Missing one doctor's appointment, like the value of these things, of even one slight difference or changing someone's life or day-to-day routine makes a big impact on their diabetes. I just people would understand the value of these things, because then I think it would make people be more aware or advocate more for the support that children in foster care need who
Mhm.
have type 1 diabetes, and
Mm,
just in general as well.
absolutely. So, Destiny, and you might have already touched on this, but if our audience takes away one thing today, what do you want it to be?
I want our audience to, one, learn about your body and learn about diabetes, but stand up and
Mm,
make a difference. That's
mm,
definitely what I want you guys to know.
it's beautiful. I want people to know there is no look to having type 1 diabetes or to being in foster care,
Yeah.
right? And so you can never judge a book by its cover in that regard. And I would also add that proactive measures such as therapy and community are critical components of comprehensive type 1 diabetes care and support. So, together, our call to action is simple but urgent. See the whole child, train caregivers, build systems that don't just treat diabetes, but that support kids and youth in every part of their lives, not only for now, but for their futures. Thank you again, Destiny. I'm so grateful for you. DeeDee, rather.
Yes, thank you.
I always appreciate our time together, and hopefully, this is the first of many. And thank you to Casey and the Diversity and Diabetes team. And last but not least, thank you to everyone who tuned in today's conversation with people of color living Diabetes Summit. We hope you have a great day.
Bye.